right, 6 minutes after 11 o'clock. Thank you for tuning in. I don't know how many of you remember the stand-up comic Robert Klein, but Robert Klein had a comedy bit, and he was like tapping his foot as he was singing a song or something, and then he was pretending like he couldn't stop his leg, and he did the song called "I Can't Stop My Leg." I don't know if anybody remembers Robert Klein doing that. Anyway, there is something called restless legs syndrome. I'm guessing it has nothing to do with the Robert Klein bit. In the studio is Dr. Myra D. Sherman. She is a doctor of nursing practice and an advanced registered nurse practitioner for family care specialists at Ocala Health. And she is the guest of Suzanne Santangelo, who's looking beautiful with her hair. Look like an actor. You look like a news anchor or something for one of those.
I need to come here more often.
Oh, really? Why, you don't get compliments anywhere else?
Like that.
Well, good to see you, Suzanne. And Suzanne, of course, is with Ocala Health. And Dr. Sherman, good morning to you as well.
Good morning.
You look beautiful as well.
Thank you. I appreciate that. Sitting by the stunning Suzanne.
Yeah. So what is restless leg syndrome?
Well, it's a neurological condition that results in restless legs.
Oh, by restless legs, what does that mean? They just keep moving?
Especially when you're at rest. Lying in bed at night, leg starts to move, and that's probably why he developed that song, because he did have...
Maybe he had it, yeah.
And probably didn't know that there was actually a disease that was originally known as Willis-Ekbom disease. So when you get in bed at night or when you're sitting there, your leg starts to move on its own. And in order to get relief, you literally have to move out of that position.
Right. Does it move from the hip on down, from the knee on down?
Primarily the lower extremities, like the knee on down.
Okay.
Yes.
And is it both legs?
Yes, it can be.
Are you kicking or just wiggling or?
You can actually kick, so that's a good reason to take out your frustrations on your spouse at night. Use that as an excuse.
Oh no. So okay, and so, but there's a cure for this, I'm guessing, right?
There is no cure.
No cure.
There is treatment, but there is no.
Okay,
cure.
so somebody who has this problem can have it fixed with medicine or with therapy?
Yes, and the thing about medications, one of the medications is gabapentin. It was originally geared for people with Parkinson's disease, but the thing is that you take the medication at night and it should help relieve the symptoms. The only thing is, the longer you take this class of medications, the higher the dose may have to go up because of that.
Get a resistance to it or something? Oh my goodness.
Yes.
And so, I mean, would it be better just to have two separate beds? I mean, is it like snoring where you don't know you're doing it?
That's individually oriented, okay? Some people can tune snoring out. Mm-hmm. Other people can tune the restless legs out. The thing is, you want the person to be comfortable so that they don't have the symptoms. Is
it something you can grow out? Do children have it? Or
some children do, especially school-age children. They develop it. There is research that shows if the person is 40 years or younger, it can actually be genetic.
Really? So it's inherited then?
Oh, my goodness. Do you have it?
No, sir.
Do you know anybody that has it?
Yes, sir. I treat patients with it.
Oh, that's okay. So that would make sense.
They actually say that at least 5% of the population has restless leg syndrome, and at least 10% of the elderly population.
So if there was somebody listening right now and they maybe heard of this before but never really heard that there was a medication for it, how do you diagnose it? Do they have to be sleeping? I mean, when you diagnose that?
No, just symptomology. The patient comes in
so
and
it just tells you what's going on.
Exactly.
Wow. And are they dreaming? Like that they're running or something?
Usually when the patient gets in that comfortable state,
right?
Maybe just fell off to sleep, all of a sudden their leg can start moving around.
Just starts moving.
Mm-hmm.
Is this neurological?
Yes, it is a neurological condition, as before said, that, and it goes along the same lines as patients who have Parkinson's, because it not saying that it is Parkinson's, but people who have Parkinson's can have it. People who have diabetes, they can also have restless leg syndrome. And you cannot have any disease process at all and develop it.
Will vitamins, I mean, if a person is nutritionally sound and then they take vitamins growing up through their years, are they still susceptible to this?
That's a good question, and there's a lot of research out there specifically focusing on vitamin D deficiency. When patients who have vitamin D deficiency, if it's tested, their levels are brought up to normal, it can subside, or the symptoms could subside in some situations.
So what do your patients sometimes say to you? I've had this for a long time, and this is what I've done. I put ice on it, or I went to a hypnotist, or have they tried things that didn't work, or maybe things that did work that weren't necessarily conventional?
The thing is, some people think it's normal. They've been doing it for so long, and they come in and their spouse may say, she's still kicking, or the patient can say, I woke up last night again doing this, and they've done it for so long they don't realize that it's a disease.
Wow. If you put your headsets on, you'll be able to hear the caller. We have a caller coming in, so I'll wait for you to get your headset on. Yeah. Okay, Robin will get Suzanne set up. Hold on, caller. Let me let them get... Myra, can you hear me, doctor?
I hear you fine.
Okay.
Myra's fine as well.
So if you can hear me, then you'll be able to hear them. Okay. Suzanne, can you hear me?
Yes. Okay.
All right. Good morning. Thank you for calling. You're on the air. Oh, let me do it again. Good morning. You're on the air.
Yes, good morning. Doctor, does this disease, can this be a situation with a child, a younger adult? And how old would it usually start onset in a person?
Well, we mentioned that a couple of minutes ago. It can develop in school-aged children. And the symptoms are basically the same as when we're older.
How would you, find out that your child has this problem? I mean, you're not going to stand over him in the bedroom and watch him see if he kicks his legs or not. What would be the clue to tell you that he had this problem, or she?
Well, a lot of times if a patient is being awakened throughout the night, they're going to have a lot of fatigue during the day. So that's something to focus on. But take them to their primary care provider, explain the symptoms that you've observed or they've spoken of, and allow them to diagnose.
You might check on and you see the leg movement and say, you're not sleeping, and then they are sleeping though.
Right.
Wow. And so could their diet have something to do with it?
A lot of times, and that's what the researchers focus on, a good sound diet, again, having the right nutrients, the right vitamins, could help subside some of the symptoms. And this is off the record per se with FDA, but a lot of my patients come in and they're drinking tonic water because they have cramps, and they also have restless leg syndrome, and that tends to help the discomfort.
Really?
Oh, tonic water does.
Yes.
Oh.
It has a little bit of quinine in it. And,
Really?
Yes, and that tends to help the cramps, which helps relax the legs.
Isn't that interesting? Wow.
How about massaging then? I mean, if a
That's
person
a great
goes to
thing.
a masseuse like once a week.
Absolutely. Just make sure that you're clear of any blood clots or anything of that nature before you go massaging your legs.
Oh, okay. So how do you do that then?
You follow it with your provider. You make sure that there's no swelling in your legs. There's no pain per se when you're awake or when you're moving around. And again, follow up with a healthcare provider.
We're up to our break, so let's take the break and we'll be right back. If you want to ask questions, you are welcome to call. The number is 622-9622. We'll be right back. This is The Source, WOCA.
The weather is brought to you by myfwc.com. Safe boating is no accident. For today, a mix of clouds and sunshine, along with an afternoon thunderstorm or two, the high 90 to 94. And partly cloudy tonight, though 73 to 77. Partly sunny tomorrow with a couple of showers and thunderstorms around, mainly in the afternoon and evening, the high tomorrow 88 to 92. On Saturday, mostly cloudy with a thunderstorm likely, the high 87 to 91. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Ocala Aviation now has opportunities for flight instructors.
Wait, hold on. Brad, is this correct? You're looking for instructors, not students?
Actually, we're looking for both.
Well, that's descriptive.
Well, I need flight instructors because we're now affiliated with a major university and can offer 4-year degrees. Plus, we're also approved to work directly with VA students.
Okay, so a degree in what, and what's a VA student?
Well, it's a bachelor's degree in aeronautics, which includes a commercial pilot's license, and there's financial aid available. By VA students, I mean veterans. They now have access to new benefits to pay for flight training.
Okay, so you have new opportunities for new students. What about the instructor side of it?
Well, with new students, we need more instructors.
Well, yeah, that makes sense.
So, if anyone out there is a flight instructor, I want to encourage them to come see me. And if they're not an instructor but have their commercial license, we can help them become an instructor.
So they get their instructor license and have a job too.
Exactly.
So you got a lot going on. The VA, the college, and now hiring instructors and future instructors too.
Yep. So now can we get the commercial started?
Already ahead of you. Call Brad to get your adventure started today at Ocala Aviation, 861-7484.
Hello, friends. This is Avilio Silvera inviting you to the 23rd Annual Silver River Friends of the NRA Dinner. Our upcoming charitable banquet is on September 10th, 2015 at 5:30 p.m. and this year at a brand new location, the Circle Square Cultural Center at On Top of the World. The $50 per person ticket gives you access to games, a live auction, silent auction, raffles, prizes, and a whole lot of fellowship and fun, not to mention a seafood and chicken dinner buffet. You're going to want to be at the Silver River Friends of the NRA dinner on September the 10th at Circle Square Cultural Center. You can call Connie Davis at 352-239-0711. Again, that's Connie Davis at 352-239-0711. This is our charitable fundraising for the year so that we can empower the next generation of defenders of the Second Amendment.
John Nottingham of the Miami Dolphins here, proud to be this year's chairman of the Special Olympics Champions for Champions event. Come join players from the world of professional sports, sharing their stories with a great dinner on Friday, September 18th, and or play at Candler Hills Golf Club on Saturday, September 19th. Either way, you'll be helping the Special Olympics of Marion County Champions for Champions. Call 988-7998 for details. That's 988-7998. Please help our Special Olympians.
All right, 18 minutes after 11 o'clock. Dr. Myra D. Sherman is in the studio. She is talking about restless leg syndrome. And, Doctor, you have somebody waiting on hold patiently. Good. Oh, okay, have your headset on? Good. Good morning. Thank you for waiting. You're on the air with Dr. Sherman.
Hi. I just had a couple of questions. One thing that happened to me ever since I was a youth. I think this is something that happens to different people, but maybe it's a common sort of thing where you're just laying down, you're sitting there, all of a sudden your leg just wants to jerk, and just one time, it just wants to, like the nerves just decide to make your leg just.
Yeah, I think I've had that too.
Involuntarily jump, it just happens one time and it's over, and that's happened to me ever since I was a kid. Every once in a while it'll happen.
But it's not keeping you up.
I don't know if that has anything to do with restless leg syndrome or not.
I don't know. Doctor, you want to comment on that? Thank you for the call.
It starts
intermittently
like that.
The other one is this is a little different, where I'd just be laying there and all of a sudden I just get get this feeling, this like niggly feeling in my leg that it wants to move or do something, and it's just sort of an uncomfortable feeling. That's just there. It doesn't last for long, but or I just forget about it or whatever. But it's like you're wanting to. It's like you feel uncomfortable and you want to move your leg, but it's just a niggly feeling. It's not like my leg is moving. It's just that's happened to me too.
Okay.
And I'll just hang up and listen and see if she has anything to say about any of that.
All right. Thank you for the call.
All right.
Okay, a twofold question. One is that restless leg syndrome does start intermittently. So you may have a sensation, today and may not have another sensation for like 6 months, or it can just be right after the other. The key is when you get up and move around, are you feeling the symptoms resolve? The next question he talked about is I think he's talking about a tingly sensation.
Yeah.
Again, getting up and moving around should help the symptoms improve. But a lot of our patients are diabetic, and they can have something called neuropathy that can cause those same type symptoms, the tingly, numbing sensation.
And you have another phone call. Good morning. Thank you for calling and for waiting. You're on the air with Dr. Sherman.
Good morning. I'm going to get some free medical advice from one of the best doctors in town. Myra was my doctor for about 7 years.
Oh, really?
So this is pretty cool. Hey, and I didn't hear the whole segment, and I'm sorry, but as far as with restless legs, that doesn't come from like if you have like an office job and you sit all day and you cross your legs, you don't get up, move around a lot. It's a whole different illness.
That's a great question, sweetheart. And hi, thank you for supporting me yet again.
Oh, I have another question, too. Can I get a prescription to have my own bedroom, that I don't have to listen to my husband snoring? Restless leg syndrome. He's a bulldog. So we can just say that because of this medical issue, I have to go to the guest room. So
there you go.
We'll talk about that another day.
We will talk about.
I'm going to hang up and listen to the rest of your program. Thanks,
All right, thank you.
She had a great question. And there's not a whole lot of research regarding like job related that I found, but think about it, it's neurological. So there's a section of the brain that produces dopamine, which is something that helps our body to smoothly, I'm trying to say it at a level where everybody can understand, but allows the body to move around smoothly. Well, sometimes there's something that has interrupted that process. So when we're lying in bed at night, that section of the brain is being stimulated and you're flexing and moving around. So again, no research that I've found that correlates with job-related stress or factors.
Sometimes people will go to an acupuncturist to have whatever it is fixed. Do you recommend that for this?
Patients are going to do what they so desire.
That's true.
And a lot of patients will go and experiment, and if they have great results, then it's just like going to a provider, and you may not get everything taken care of at one time, but eventually you will. So yes, going to a acupuncturist would be beneficial. That's from my own perspective. Anything that will help the symptoms that's legal,
there you go.
I think would be beneficial.
I'm guessing it burns calories. There's probably a good side to this, right?
I don't know about that.
All right, we have another phone call. Good morning. Thank you for calling. You're on the air with Dr. Myra Sherman.
Hey, good morning. Does restless leg syndrome have anything to do with sleep apnea?
Does that make sleep apnea?
Again, I have not seen any, and remember, I don't know everything about restless leg syndrome. There's a lot of data out there, but what I've pulled up research-wise, I have not seen that correlation.
Okay, because the reason why I'm asking, because I noticed that when I'm sleeping and I cannot breathe, I have to shake my leg to wake me up to get me out of that.
Oh, really? Wow.
Yeah. So I'm aware that I'm not breathing, but I have to shake my leg, and it enables me to get up, to wake up out of it.
So, excellent question. Every patient is different. So if that's what it takes for you to, be aroused from that state, then by all means continue to do that. The other thing is, that's your body's way of triggering, you to wake up. Some people with obstructive sleep apnea, the brain just automatically wakes you up. When you've been asleep for so long and you're not breathing for maybe 20 to 25 seconds, the body stimulates you to wake up.
Right. Yeah. Okay, thank you.
It's a good thing. I mean, otherwise we might not wake up at all.
Not wake up.
That's right. Does this happen to people that run all the time? to runners. Could it happen to them?
I mean, it could happen to anyone, not necessarily, a person who's just that, lackadaisical. It can happen to anyone. One of the things that I read was people who sit in the movie theater, and because they haven't been moving around very much, it triggers, the restless leg movement. So when you see people stand up in the movie and stretch, that could be related to that. Other people, they can't stay in the car very long on trips. They have to get out every 1 to 2 hours and stretch their legs because their legs, are moving on their own.
Oh, okay.
So back to your question with jogging or runners, I would think theirs would be fine because they're actually moving. And it's the movement that helps.
So if we would walk every day, even though you wouldn't, maybe walk a mile or something, that would probably help deter this thing.
I like that. I can encourage my patients to do that because you don't want to have restless leg syndrome. Get out and walk.
So everybody doesn't stop every 2 hours when they're on a road trip? I think I stop every 2 hours.
I didn't say if you didn't have bladder issues because that would cause you.
Oh, that's what it is. So does somebody with restless leg, let's say they sleep alone, do they wake up with sore legs?
I think they will wake up more fatigued than anything, more tired from moving around so much.
So they never get any rest at all?
To a certain extent, they do, and that's why they seek their provider, when they can't sleep.
Well, I would say if somebody's listening to this, and this sounds like you or somebody you know, then hopefully this show will lead you in the direction of going to get some help.
Absolutely.
Can this be misdiagnosed?
Yes, because like I said, it runs a close race with neuropathy and different disorders like that. So, but the good news about neuropathy, the gabapentin that I mentioned earlier will also help the restless leg syndrome.
Wow.
How do you
are wonderful.
Spell that? Gabapentin? How do you spell?
G-A-B.
Oh, Gab. Okay.
No.
G-A-B.
G-A-B. It's if you would not have asked me, I could have spelled it off right away.
Well, that's a good start.
Gabapentin.
G-A-B. I did take my doctorate. I have my doctorate.
I know.
A-P-E-N-T-I-N.
Okay. Gabapentin, okay.
But there's also other medications. There's ropinirole and different ones that you can also use. But again, it's prescription, so your provider would have to prescribe that for you. So don't use your neighbors or your sisters or,
No.
Exactly.
No, never do that.
Shouldn't self-diagnose either.
Exactly.
Well, thank you for coming in. I don't think we've ever talked about this before. Dr. Myra D. Sherman, do you want to give out your contact number? Or?
Yes, we're at 352-351-0120.
Okay.
And we're located over in Tealbrook off of 17th Street.
Oh, okay. That's a nice area right there. Tealbrook, nice complex. Yeah.
I got that Robert Klein song on my head. I can't stop my leg. I can't stop my leg. So, Suzanne, do you have any numbers you want to give out?
Well, yeah. I mean, if you can't get in, Dr. Sherman also practices with Dr. Nelson, who we've had on the show before, too. So they're together in that location. But if you still need a primary care physician or a specialist, you can call our physician referral line, which is 800-530-1188. And that's also our nurse line. Help answer any questions that you might have about medications or any conditions that you have, and they can maybe answer some further information about this condition too.
So, all right, great stuff, Suzanne. Yeah. Thank you for all the great shows you bring to us.
Glad to be here.
You know what I think I found? I can't stop my leg. Let me see if I can. if I can leave with that song.
You're gonna have to play that next time.
Hold on, I think I have it right here. I think I think this is it right here.
Really?
I think so. Do you hear it? Where is it?
Sounds jazzy.
Oh, what a treat.
No, it's probably not going to get... Oh, I guess we're not going to hear. Dr. Sherman and Suzanne Santangelo, thank you both.
You're welcome.
We'll take a little break. We'll be right back. This is WOCA Ocala.
is a Fox News alert. I'm Lillian Wu. The judge in the Deflategate court case tossing out Tom Brady's 4-game suspension.
Patriots quarterback cleared to suit up for his team's season opener next week. The surprise ruling by the U.S. District Judge Richard Berman came after more than a month of failed settlement talks between the NFL and its players' union. Many legal experts believe the judge was merely pressuring both sides to settle when he criticized the NFL's handling of the case at 2 hearings in August.
Fox Radio's Tanya J. Powers. The Kentucky clerk who refuses to grant marriage licenses to same-sex couples speaks exclusively to Fox Radio's Todd Starnes, who asks her,
Are you prepared to go to jail tomorrow?
I am.